Go.
Hi, my name is Bissett, and my main story tonight concerns the American rural healthcare crisis.
The plug pulled on yet another Tennessee hospital.
The area's only hospital is shutting down.
Several hospitals are closing.
It's devastating.
A whole cross-section of America is now facing the very real risk they'll have no local hospital to turn to.
Since 2010, more than 130 hospitals in rural areas closed their doors. That's more than one a month, or roughly 4% of all rural hospitals across the United States. As a result, rural residents had to travel on average about 20 miles further for common healthcare services, like inpatient care, and 40 miles further for less common services, like alcohol and drug misuse treatment. In emergency situations, the extra mileage can mean life or death. To better understand this issue and to propose some potential solutions to the rural healthcare crisis, in this video, I'd like to ask, how did we get here? What are some of the current barriers to healthcare for rural Americans today across racial and ethnic groups and income levels? And what are we currently doing to address this crisis, and what can we do going forward to make it better? So let's start with that first question. How did we get here? The fall of rural healthcare access in America can be directly correlated with the mass movement of Americans from rural areas to cities. According to FWD.US, between 2000 and 2010, 346 rural counties lost 5% or more of their working age populations. From 2010 to 2020, the losses nearly tripled, with more than 970 rural counties losing 5%. And population declines are expected to continue. Between 2020 and 2030, 694 counties will likely see decreases of 5% or more in their working age populations. This mass exodus means less revenue for hospitals across the United States. Without proper government funding, many hospitals could not survive this major change, and in many cases, that means the loss of specialists, primary care physicians, and hospitals altogether. Even worse, insurance companies are reimbursing hospitals at much lower rates than before. In Kansas, in 2019, public and private insurers didn't reimburse $22 billion in medical charges, 2 times more than 2011. So more hospitals are making less money, which leads to closures and loss of vital healthcare services. That is particularly frightening for those who can't afford to leave. Just listen to Mary Oswald, who worked as a nurse in Horton, Kansas for nearly 30 years before their hospital was closed.
I think that there's a healthcare crisis in rural Kansas.
There's things that a rural hospital can't do, but it's that intervention and getting things moving quickly that affects the outcomes. Time in an emergent situation can mean life or death. I think we need some kind of a system in place that people know, there's going to be care available. And I know the clinic is trying to provide health care in the community, but I don't know how well they're doing.
Do you worry that Horton might not be here in 50 years?
Well, it makes you wonder. It took a big chunk out of Horton.
Next week, we'll explore more causes for healthcare inequality, including attitudes towards mental health treatment, with stigma and stress as main focus points, systemic causes of racial healthcare inequality, as well as discrepancies in mental health care, as well as challenges and strategies for addressing these disparities. Thank you, and tune in next week.